We came up with some key facts, and we are going around to the units and we are educating the nursing staff on how to properly turn, where the proper placement of pillows or wedges should be. My name is Jackie Allard, and I'm a wound ostomy continence nurse that works here at Methodist Hospital. We are certified nurses that are specialized in the gastrointestinal, the genitourinary, and wounds, skin issues, so integumentary. We see patients with complex wounds and also pressure injuries, and then we also work with incontinence patients, and we mark patients who are going to get an ostomy, and then we do follow-up education with them after surgery. An ostomy is either a urinary or fecal diversion where surgeons take a part of the intestine and they bring it up to your skin for either to have urine come out of it because you've had bladder cancer and you've had your bladder removed, or for multiple different reasons because of, it could be cancer, it could be a blockage, it could be trauma for fecal, and then they bring part of the intestine and then you wear a pouch over it. Sometimes those are temporary and sometimes those are permanent for the rest of their life. Patients that have had an ostomy for any length of time can have complications. They can have skin breakdown, they can have, because after surgery your belly and your abdomen changes, so you might need a different type of pouch. And a bedside nurse isn't going to have that knowledge to realize we need to go to a different pouching system. We are educators because we educate nurses and we also educate the patients. We are collaborators because we work with occupational therapy with our ostomies. We work with case management to discharge. We work with the doctors on a daily basis. We work with the nurse practitioners. We work with PT wound teams. So we are huge on collaboration. We're innovators because some of the complex wounds that we have and what we do to try and contain the drainage of a wound is kind of a trial and error thing. Just the satisfaction that I'm helping that patient out who's sitting in a world of fear. It's a very emotional piece for the patients, because if they're getting a new ostomy and having poop come on your belly, it's just not what we were raised to think is normal. And so, but then I get them to accept it and be able to care for it is a very rewarding thing. And then to see people improve and the wounds heal and get smaller, and the patients go from where I think they're not even going to walk out of this hospital to they're walking out of this hospital, and I get to see that piece and know that we had a part in getting them there is very, very rewarding.